Hi, I'm Dr. Rob Danoff for ARIA Health Medical Mythbusters. All right, you ready? This was the myth or the fact. If you're a woman or you have a loved one who is a woman and who has fibroids, the only option is surgery. Is that a myth or is that a fact? Well, joining us here today is Dr. Aaron Shiloh, who is the Section Chief of Interventional Radiology at ARIA Health. Dr. Shiloh, is surgery the only option? So is this a myth or is this a fact?
Well, in fact, Dr. Danoff, it is a myth. Surgery is not the only option for women who suffer from fibroids.
Well, I'm glad to hear that because many women are affected with fibroids. What exactly is a fibroid?
Well, a uterine fibroid is a benign tumor of the uterus, not cancer, so we have to be clear, it's not cancer, it's benign, and it's a tumor that grows from the muscular wall of the uterus.
How would a woman generally know that maybe she has one? What are some of the common symptoms or signs?
The most common symptom that women complain about when they have fibroids is heavy bleeding. But there are other symptoms like pain, like increasing size of their pelvis, like pressure on their bladder, frequency of urination, pressure on their colon, and many others. And they typically find out either by reporting it to their family doctor or to their gynecologist, and then it's a very simple evaluation. They usually end up with an ultrasound, which will then elucidate that they do have a uterine fibroid.
So it can really cause a lot. You know, Dr. Shiloh and I were talking a little bit earlier about when you hear the word surgery, a lot of times women, you don't want surgery, so you'll live with some of this pain or some of the bleeding. You know you have a fibroid, you know it's not cancer, but you don't want the surgery. But I understand, and I know from sending patients, that you are kind of one of the originators in this whole area of a different type of procedure. You do a lot of them, you get great results. Tell us a little bit about what the option is besides surgery for fibroids.
Well, there are actually multiple minimally invasive treatment options for uterine fibroids. The one that I perform is called a uterine fibroid embolization. And in this procedure, we are basically accessing the artery in the groin, the femoral artery, putting a catheter into the artery to the uterus and sending in small particles that will then cause the fibroids to shrink, like taking a grape and turning it into a raisin. And over time, as the fibroids shrink, the amount of effect or mass effect on the adjacent structures goes down, and you can have pretty much a very quick relief, in some cases within a couple weeks. Sometimes it takes several months as the fibroids shrink to really get the full benefit of the procedure.
See, that's phenomenal, and I'm wondering, would any woman be eligible to have the uterine fibroid embolization, or are there certain types that are more, options for them?
Well, as part of the evaluation process, we do look for the types of fibroids that you have. And with fibroids, it's like real estate, location, location, location. So really dependent upon where the fibroids are in the uterus will determine what symptoms you have. And at the same time, if the fibroids are in a bad location or something about them isn't right, we won't advise to do the procedure. That being said, the large majority of women, in fact probably 9 out of 10 women, are in fact candidates for this minimally invasive procedure, which the major benefit is that it's a very short recovery period. There's no incision, no cutting, and you can be back to work within a week, as opposed to other treatments where the recovery period is much longer and makes it just a little bit harder to do or to have this procedure done.
That's awesome. You know, so there's other treatment options besides surgery out there, and if you're a woman or you have a loved one who has uterine fibroids, you know that they can be really painful or have other symptoms. So if you'd like some information about options different from surgery, or even surgery if it's needed, but we have lots of options here at ARIA Health, please go to our website at yourariahealth.org. You can get in touch with Dr. Aaron Shiloh or his team, talk to your family doctor, and we'll work together to help you have better health.